Welcome to week 2 of Healthcare Signals That Matter. With me, Meghana Arun Pillai, powered by Intent.Health. This week, the healthcare market sent some very loud signals. AI in healthcare is entering liability territory. GLP-1 economics are becoming volatile and hyper-competitive. Government oversight across healthcare is intensifying. Public health communication is once again becoming a national priority. And healthcare businesses are increasingly being shaped by regulation, litigation, operational efficiency, and capital flow, all at the same time. If you sell to healthcare, market to healthcare, invest in healthcare, or operate within healthcare, these are the signals you need to be paying attention to. Let's break down what happened last week and, importantly, what it actually means. Segment 1 of the week: AI, digital health, and healthcare liability. Story 1 of the week: OpenAI faces lawsuit over alleged harmful chatbot advice. One of the biggest healthcare adjacent signals this week came from OpenAI. The company is facing legal action alleging harmful advice generated by its chatbot. The signal here is massive. AI is officially entering liability territory. Healthcare organizations are now moving from asking, can AI improve more efficiency, to asking, who is responsible when AI gets something wrong? For healthcare businesses, this means compliance scrutiny will increase, human oversight will become mandatory, clinical AI adoption may slow without governance safeguards. AI explainability will become a buying requirement. Story 2 of the week: Isomorphic raises $2.1 billion for AI drug discovery. At the same time, Google-backed Isomorphic Labs raised $2.1 billion for AI-driven drug discovery. The contrast is important. AI may face growing regulatory scrutiny in patient-facing environments, but capital is still aggressively flowing into scientific and discovery-focused healthcare AI. The signal: healthcare AI investment is becoming more specialized and outcome-driven. Segment 2 of the week: GLP-1 economy and consumer health. Story 3 of the week: Hims & Hers raises revenue forecast. Hims & Hers raises its 2026 revenue forecast last week. The signal: consumers are increasingly comfortable buying healthcare like a subscription service. Digital healthcare, telehealth, wellness platforms, and direct-to-consumer models continue to gain momentum. Story 4 of the week: Hims & Hers shares fall after weight loss pivot. But almost immediately after the announcement, Hims & Hers shares fell, flowing pressure from its weight loss business strategy. This highlights one of the biggest healthcare signals of 2026. The GLP-1 market is no longer just a demand story. It is becoming an operational execution story. Patient acquisition is expensive, retention is hard, supply chain matters, and profitability pressure is growing fast. Story 5 of the week: Lilly halts obesity awareness campaign. Eli Lilly also halted an obesity awareness campaign after regulatory scrutiny. The signal: the GLP-1 economy is now entering a phase of regulatory sensitivity. Healthcare brands operating in obesity, wellness, and metabolic health should expect increased advertising scrutiny, compliance oversight, ethical marketing expectations, and public policy attention. Segment 3 of the week: government, policy, and healthcare oversight. Story 6 of the week: US halts Medicare enrollment for home healthcare and hospice providers. The US government halted Medicare enrollment for new home healthcare and hospice providers in some regions. This is a major signal around reimbursement oversight and fraud prevention. The message from regulators is clear. High growth reimbursement heavy healthcare sectors are now under deeper scrutiny. Story 7 of the week: Medicaid funds deferred to California. The federal government also deferred $1.3 billion to Medicaid funds to California. The signal: healthcare funding is becoming increasingly political, operational, and state sensitive. Story 8 of the week. US moves to end health department job protections. The government is reportedly moving to end job protections for hundreds of health department workers. The signal, healthcare agencies themselves are entering a restructuring phase. Expect more leadership turnover, organizational realignment, policy instability, and operational uncertainty. Story 9 of the week. FDA Drug Center leadership exit. The head of the FDA Drug Center is also expected to leave. The leadership transition inside healthcare regulatory agencies are major market signals because they often influence drug approvals, regulatory speeds, industry confidence, and compliance expectations. Segment 4 of the week. Public health signals. Story 10 of the week. CDC monitoring Ebola outbreak. The CDC is monitoring Ebola outbreaks in Africa while assisting response efforts. The signal, post-COVID global outbreak monitoring infrastructure remains highly active. Story 11 of the week. Hantavirus outbreak tests health communication models. A hantavirus outbreak is now testing post-COVID public health communication strategies. The signal, public trust and communication are now critical healthcare infrastructure. Story 12 of the week. White House receiving daily hantavirus updates. The White House is reportedly receiving daily hantavirus updates. The signal, localized health events can now escalate into national monitoring concerns very quickly. Story 13 of the week. WHO warns about nicotine pouches. The WHO warned about youth addiction risks tied to nicotine pouches. The signal, alternative nicotine products are entering the same regulatory cycle previously seen with vaping. Segment 5 of the week. Provider risk, legality, and care delivery. Story 14 of the week. New York hospital faces transgender care probe. A New York hospital system received a grand jury subpoena tied to transgender care investigations. The signal, healthcare delivery is becoming deeply intertwined with legal and political pressure. Story 15 of the week. Rhode Island hospital wins court protection. A judge blocked efforts to restrict transgender care at a Rhode Island hospital. The signal, healthcare providers now increasingly operate in legally fragmented care environments. Story 16 of the week. Texas hospital launches detransition clinic. A Texas hospital plans to launch a youth detransition clinic after settling a state probe. The signal, healthcare service lines are increasingly being shaped by regulation and political environments, not just patient demand. Segment 6 of the week. Pharma and Healthcare Innovation. Story 17 of the week. Lilly launches Alzheimer's drug in India. Eli Lilly launched its Alzheimer drug, donanemab, in India. The signal, global expansion for specialty therapies is accelerating rapidly. Story 18 of the week. US clinics rush toward experimental pancreatic cancer drug. Cancer clinics are rushing to access an experimental pancreatic cancer therapy. The signal, oncology innovation demand remains extremely high. Story 19 of the week. ADHD drugs may help cancer fatigue. Researchers found ADHD medications may help reduce cancer-related fatigue. The signal, drug repurposing is becoming strategically important because it lowers development time and cost. Segment 7 of the week. Healthcare operations and capital markets. Story 20 of the week. Insurers benefit from easing medical costs. Health insurers are benefiting from easing medical costs, but analysts warn bigger risks remain ahead. The signal, payer profitability may stabilize short term, but long-term utilization pressure remains unresolved. Story 21 of the week. Steris forecasts strong profit. Steris projected stronger profits driven by medical procedure demand. The signal, healthcare utilization remains resilient. Story 22 of the week. YesCare loses 80% revenue after malpractice verdict. Prison healthcare company YesCare reportedly lost 80% of revenue following a malpractice verdict. The signal, clinical failures now directly threaten enterprise survival. Story 23 of the week. CVS Omnicare wins approval for asset sale. CVS owned Omnicare received approval to sell generics. The signal? Healthcare companies continue restructuring and simplifying operations. Story 24 of the week. GMR raises nearly $479 million in IPO. Ambulance giant GMR raised nearly $479 million in its IPO. The signal? Healthcare capital markets remain highly active for infrastructure and operational healthcare assets. So, what were the healthcare signals that mattered last week? AI is moving into accountability territory. GLP-1 are evolving from hype into operational competition. Healthcare regulations is intensifying. Public health communication is now strategic infrastructure. Healthcare organizations are restructuring under pressure, and capital continues flowing aggressively towards healthcare innovation. But the biggest signal may be this. Healthcare is no longer operating as isolated industries. It is operating as one ecosystem where policy, technology, operations, capital, and consumer behavior constantly influence one another. And those who understand the signals early will move earlier than the market. This is Meghana Arun Pillai, and you're watching Healthcare Signals That Matter, powered by Intent.Health. See you next week.